What explains the variability of CF symptoms in identical mutations? Imagine two people with the exact same genetic change causing cystic fibrosis. You might expect their symptoms to be identical, but in reality, they can be very different. This is because cystic fibrosis is influenced by many factors beyond just the primary mutation in the CFTR gene. While the CFTR gene mutation, like the common delta F508 mutation, is the root cause, other elements shape how the disease shows up in each person. One major factor is modifier genes. These are other genes in the body that can influence how severe cystic fibrosis becomes. For example, some genes related to immune response can affect how the body handles lung infections or inflammation. Variations in these genes can make a person's lung disease milder or more severe, even if they have the same CFTR mutation as someone else. Modifier genes are a big reason why two people with the same mutation can have different health experiences. Another factor is complex alleles. Sometimes, more than one mutation occurs on the same CFTR gene copy. These additional mutations can either make the disease worse or help lessen its effects. The overall genetic background, which includes many other genes outside of CFTR, also plays a role. This broader genetic makeup can influence how the disease develops and how severe it becomes. Environmental influences are equally important. Factors like exposure to infections, nutrition, access to health care, and environmental pollutants can all impact cystic fibrosis symptoms. For example, early treatment of lung infections can improve long-term health, while exposure to cigarette smoke or pollution can worsen lung function. These external factors can significantly modify how the disease progresses. Epigenetics also contributes to variability. These are changes in gene activity that do not alter the DNA sequence but can turn genes on or off. Such regulatory mechanisms can affect how much CFTR protein is produced or how other related genes behave, influencing symptom severity. Research shows that even among individuals with two copies of the delta F508 mutation, there can be a wide range of disease severity. Some may have mild lung issues and be diagnosed later, while others face severe complications early on. This highlights that genetics, environment, and regulation all work together to shape each person's experience with cystic fibrosis. In summary, the differences in symptoms among people with the same CFTR mutation come from a complex mix of modifier genes, additional mutations, environmental factors, and gene regulation. Understanding these influences helps doctors tailor treatments and gives hope for better management of cystic fibrosis. If you or someone you know is affected, it's always best to consult healthcare professionals who can provide personalized advice based on individual circumstances.